So today's webinar is Hong Kong in response to COVID-19, and it is an honor to invite Mr. Ivanhoe Chang, the Director of Hong Kong Economic and Trade Office of the San Francisco, and also Mr. Lawrence Chiu. He is the officer in charge of Hong Kong Trade Development Council of Los Angeles. And today's webinar will be moderated by our board member, Ms. Kory Lam, and she's also the VP Customer Branch Manager of the HSBC Bank USA. So before we start today's webinar, there's a few things I would like to remind you. So if you're welcome to submit your questions anytime in the Q&A window located on your toolbar, and all the questions submitted will be discussed at the Q&A section, which will be at the end of the webinar session today. Please raise your hand if you encounter any issues. And at the end of the webinar, you will be asked to participate in a 2-minute survey. We welcome your feedback because all of your feedbacks will help us to improve our future events. Also, the last thing to remind you is today's webinar will be recorded. If you'd like to rewatch the recording afterward, you're welcome to visit www.hkanc.com/blog. So that is all. Thank you very much, and I hope you enjoy today's presentation. And now I will pass it to Kory. May you all please welcome me in welcoming our panelists, Mr. Ivanhoe Chang, Mr. Lawrence Chiu, and Ms. Kory Lam. Thank you.
Hi, good afternoon. First of all, I really want to thank Yanni and the program committee to organize today's virtual discussion. I'm so happy to be here today. My name is Kory Lam. I'm the Board of Director of Hong Kong Association of Northern California. I'm the moderator in this session today. Before we start, I want to give you some background of Ivanhoe and also Lawrence. Ivanhoe is a director of the Hong Kong Economic Trade Office in San Francisco for represent the Hong Kong Special Administrative Region government in look after economic ties between Hong Kong and 19 states in the western part of the US. Lawrence is the officer in charge for Hong Kong Trade Development Council, Hong Kong TDC. His LA office overseeing the council marketing and promotional activity in the West region of the US. Hong Kong TDC's mission is to create opportunity for the Hong Kong government. Here is today's agenda. First part, we will have Ivanhoe to share with us how Hong Kong responds to COVID-19. And after that, we will have Lawrence to give us the market update in Hong Kong and Mainland China, and also the upcoming Hong Kong TDC program. And after that, we will have a Q&A session. So please feel free to using the Q&A session, submit it to Ivanhoe. Thank you.
Thank you, Kory. Good afternoon, dear fellow members and also friends of the Hong Kong ANC. First of all, my thanks to ANC for having me at this webinar. And I have been asked to share the experience of Hong Kong in handling COVID-19. I'm sure you have read a lot on news, on social media, etc., as to various jurisdictions has handled COVID-19. So I do not intend to go through a list of the measures that Hong Kong has really implemented, but to give you some sense of how certain aspects, in particular, that might be of relevance to, for example, the US or the Northern California that we are currently in. But before we say so, before I say these issues, I'd like to point out that certainly in the past few months, governments around the world have worked very hard all to handle the pandemic, but often balancing between maximizing protection for public health and minimizing the economic impacts that may be brought about by these relevant measures. And although the overall objective would be the same, it would be fair to say that each jurisdiction encounters a distinctive set of problems due to the different circumstances in each society. Therefore, when I look at the jurisdiction's efforts and progress in containing a pandemic, I try not to simply compare the number of confirmed cases, but instead try to read into the context. For example, some society characteristics have effects on the spreading of the infectious disease, as well as the available measures for containing the spread. Some factors you certainly will know would, for example, include the population of the jurisdiction we look at. The more the people, the easier it will spread. And of course, not only the population, but the population density. The closer the people together, of course, it will be easier for the spread and more difficult to contain it. And then, of course, there will be other factors like the internal movement of the people, as well as the external movement of the people around. And if we look at these various factors and we try to impose it into the Hong Kong situation, in the case of Hong Kong, we are a city of 7.5 million. It is roughly the same as the aggregate population of the 9 counties of San Francisco Bay Area. But in geographical size, we are about the same as only the San Mateo County. So you get an idea of how densely populated Hong Kong is. And when we talk about internal movement of people, for those who have been to Hong Kong, many people daily travel on the MTR, our underground railway system. And normally on a weekday, the ridership can rise up to some 5 million riders per day. As well as external movement of people, you all know that Hong Kong is a very externally oriented economy. So we receive a lot of guests, both business as well as tourists. Just in year 2018, we have 65 million visitors in that year. So you can have an idea of the difficulty of containing this pandemic in Hong Kong. But with that said, there are a number of key principles that Hong Kong used in order to try to control this. If I may try to share just a few slides. Hold on. Okay, I hope you can all see it now. Okay. A few key principles that we use. First of all, is a prompt response. And then we need to stay alert, open and transparent, and use scientifically and data-based measures. Very soon, I'll be illustrating some graphs, and I'll let you know how these major principles will help Hong Kong to contain the pandemic. And there are a few major areas of efforts, which include travel-related restrictions. This is important, as I mentioned. Every year, we receive some 65 million visitors to Hong Kong. And with this pandemic, I mean, if there is no restrictions related to travel, it would be easier, in particular in the early stage of it, in particular when we are not so knowledgeable about the disease when it first developed. These travel-related restrictions help us to limit the number of people who might have been infected entering in Hong Kong and spreading the disease in Hong Kong. Quarantine and isolation, we've all seen it, but I'll tell you later on how we do this. And then physical distancing or social distancing. We have been doing this for a while already. Right now in the San Francisco Bay Area, I think most of us have already been at home for more than 2 months now. And of course, we are looking forward to the relaxation. Okay, now let's look at some graphs. Now, this is a graph that everybody can get access to. It is on the government website. It is updated daily. It is all very open and transparent. This graph is dated May 15 because I prepared this before the weekend. But if you go onto the website today, you'll see the latest one. You'll see the number of reported cases starting from January 17th all the way down to right now. Actually, the number of the first reported cases started on the January 23rd. It is the same day when Wuhan was locked down. And as a matter of fact, we are 2 days later than US, when in Washington State, received the first confirmed case on January the 21st. And then you see that during the whole process, there has been ups and downs. And in particular in March, there are some more major increases in the numbers. I'll explain a bit later why there is such a cases. But first of all, at this point of time, I would like to ask you one question. In Hong Kong, most of the cases actually are imported. Which is the source of these imported cases? You think it will be mainland China? You think it will be US, UK, continental Europe? Try to think about an answer and I'll tell you the right answer. Okay, and then if we look further, you'll see that this is the number of cases which is broken down into imported cases and also those who are spread locally. You'll see that most of these are actually from outside Hong Kong, all these in blue color. And right now there are 1,053 as at last week as well as today, because for around 3 weeks we do not have any new cases except last week when we had 3 cases. So the number stays the same. Now, I just asked you one question, is to guess which is the jurisdiction from which we received the most number of cases. Some of you may think that given our close relationship with Mainland China, there might be a lot of cases coming in from Mainland China. The answer is actually there were only 20 cases which came from Mainland China. And we received the largest number of imported cases, which is more than 400 from the UK. And then 85 from the US, which is the second largest source. If we go back a little bit, you'll see that most of these cases actually happened around March. It is in this period of time when you would probably remember that when the situation in UK as well as in the US starts to worsen. And a lot of Hong Kong residents who studies or who work or live in US and UK came back from this jurisdiction to Hong Kong. And that's why we had a major upsurge of these numbers. If we discount these cases, the actual case in Hong Kong local is actually rather small. Next one, this is the number of cases. When we always talk about flattened curve, etc. But in addition to the number of confirmed cases, one graph that is very important is the number of hospitalized cases. You will see that this line, which at the beginning tracked exactly the same as the total number of confirmed cases, then started to deviate because some people start to be leave the hospital because they have been cured. And then it started to rise up again, close to the graph of the total number of confirmed cases, and then drop back again. Right now, we have only about 20 or 20-something cases, or 20-something hospitalized patients of COVID-19 in the hospital. So the workload of the hospitals has substantially diminished. But if you look at here, there was at some point of time more than 600 cases in the hospital. Does it mean that the situation at that period of time was very serious in hospital? Yes, there's quite a large workload for the hospital. But it doesn't mean that all these people have serious symptoms. Because in Hong Kong, we treat confirmed cases quite differently from what we're doing here in the United States. In Hong Kong, all those who have been tested to carry COVID-19 will be admitted in the hospital. There's no choice. People do not just go back to their home to wait to heal from the disease. They all go into the hospital. This is very important. As I mentioned, Hong Kong is a very densely populated area. For people to go back home, in particular when they're carrying the disease, it would be quite dangerous. In particular, they will be living very close to the neighbors, and some of them may inadvertently spread the disease. And that's why, although there's a large number of people, in the hospital, it doesn't mean that all of them carry very strong symptoms. But after all, we are able to contain this, and then the number of people in the hospital right now is only very small, so that our hospital can, kind of manage the situation. Now the next map, this is a map of Hong Kong for those who have been familiar with us. I want to show this to you because, for one thing, you can see the number of cases, number of people who have been discharged, those hospitalized, and overall there are now 4 who have passed away. But more importantly, you will see on this right side some further information. It is the status and report on every case. You see this is case 1053, which was the latest, which was confirmed on May 15. Each case, you will see whether he's a Hong Kong resident, whether he has been hospitalized, whether it's an imported case, etc. And for these dots that you see on the map, they show where exactly these cases are. Why do we need this information? It is important because it can let people know where geographically these places are located. But also so that people who are living around or who work around, they know that they need to be particularly vigilant. But of course, it is important to protect personal privacy as well. That's why although we show this information, we never release any personal data of those infected. But all these information, they are very important, not only for the people who know about the situation, but also for the government to make policy decisions. Because as I mentioned, we will make all policy decisions regarding the measures based on science and data. And with a very vigilant tracing and testing system, we make sure we trace every confirmed case, who they have been in contact with, so we can quarantine their close contacts, as well as to make sure that everybody who they have been in contact with will be closely monitored in terms of their health condition. This helped further to contain the spread. And right now here in the US, of course, everybody is talking about contact tracing and pumping up the tracing capacity as well. This is something that we have been doing. And how do we do it? For example, for those who entered via the airport, many of them have been issued a bracelet. It is a locally developed technology which uses geofencing, so that we know that when a person who should be home quarantined, if they leave their home to go to a different environment, the government will know about it and take enforcement action. We use geofencing rather than GPS because it is one way also to protect the personal privacy. They may not want to know people to know where they have been to. The important thing that we need to know is that they have left their home. That's why we use a different technology. And through these various things, I think these are the things that we want to show. And because of time, probably I will stop here, and then if there are further information, I can maybe share later. Thank you, Kory. I will put this back to you.
Okay, yeah, thank you, Ivanhoe. This is really good to know what does Hong Kong do, so we can learn from it. Now I'm going to passing the time to Lawrence to talk about market update in Hong Kong and also in mainland China. You can take it away, Lawrence.
Mute. Thank you, Kory, and thank you, Yanni, for inviting me to join this webinars. I'm going to share screen and put up the PowerPoint. Okay. Right, good afternoon, everyone. I'd like to start by giving a brief introduction of our service. The Hong Kong Trade Development Council is the official trade promotion body for Hong Kong, responsible to promote, assist, and develop Hong Kong's trade. We organize international exhibitions, conference, and investment missions to create business opportunity for SMEs in mainland China and international market. Our trade portal, HKTDC.com, and business matching service help buyers and sellers conduct business online and offline. We also provide up-to-date market insights and product informations via our trade publications, research report, and digital channels. We have 50 offices globally, including 13 in mainland China and 3 in the US, to help promote Hong Kong as a two-way global investment and business hub. COVID-19 pandemic has disrupted economic activities and daily life around the world. Manufacturers have been shut down and scaled back their productions due to quarantine requirement. The logistic bottleneck caused by cancellation of flights, border closure, etc., also made the transportations of goods more costly and time-consuming. Work from home arrangement, social distancing, shop closures, and travel restrictions have dampened consumer sentiments. Companies of all sizes are busy digesting and responding to this global crisis and the high level of uncertainty that comes with it. Now let's take a look at Hong Kong's economic performance under this pandemic.
Lawrence,
yes.
I'm sorry. Is this okay?
Yes.
Because we couldn't see your screen, the PowerPoint. Maybe can you make sure that you can click it so we can see the screen? Because
hang on.
Yeah, no problem. Because I think that sure. Yeah, I think it will be easy for us to follow the picture. Yes. Yeah, thank you.
Okay.
Thank you.
All right, so sorry about that. So let's go back to these slides. So the export in Hong Kong actually has already slowed down last year, weighed down by the US-China trade. Tension and slow economic growth was due to partly due to the social unrest in Hong Kong last year. Total merchandise export recorded has recorded a negative growth of 4.1% year-on-year. The trade environment has turned even more gloomy as demand for Hong Kong export market remained weak amidst the pandemic. GDP growth has contracted 5.3% year-on-year as of March this year. Total numbers of visitors to Hong Kong dropped 81% in the first quarter. Average hotel room occupancy was only 32% in March, while the average room rate decreased by 30% to $123 US dollars. Air traffic also collapsed in first quarter with 8.2 million passengers and 6,300 flight movement, representing a year-on-year decrease of 57% and 40% respectively. Cargo throughput also decreased by 11%. The Hong Kong International Airport has closed one of its 2 runways since April 8, as many airlines have suspended their flight operations. For example, Cathay Pacific Airways operates only 4% of its scheduled service in April and in May. Retail sales in Hong Kong dropped significantly by 42% year-on-year in March due to the low consumer sentiment and the punch in the tourism industry. Retail sales is expected to remain under pressures in the near term while we wait for tourism to rebound and the over-consumer sentiment to rise, likely in the second half of the year as economic activities resume. With respect to the labor market in Hong Kong, it shows a sharp deterioration under the pandemic. Unemployment rates reached 4.2% in the first quarter, which is the highest in more than 9 years. Now let's take a look at the mainland China market. The pandemic has tipped China's economy to its first decline since 1992. GDP growth has contracted 6.8% in the first quarter. In terms of industrial output, it actually experienced a negative growth of 13.5% between January and February. However, the industrial output growth has regained its momentum as factories started to resume productions. According to the mainland government statistics, 97% of the enterprise have already resumed productions. Manufacturing PMI has rebounded from 37.5 in February to the expansion phase of 50.8 in April. Consumer demand has slowed in China. Total retail sales dropped by 19% in the first quarter due to the quarantine measure applied in February and March. However, the outbound has boosted the online purchase. Physical goods online sales was up by 6% in the first quarter, which account for 24% of the total retail sales in China. Stay-at-home economy became the new way of life in Hong Kong, China, and even in the US. Consumers became more and more adapting to shopping and take-out food order online. Home entertainment with electronic gadgets and online gaming are in high demand. E-learning from school and extra curriculum also became more and more popular. The major trend is a shift to online, not only for B2C on retail, but also B2B for business and sourcing. With HKTDC's sourcing fair in April and in May postponed to July, our exhibition have gone virtual through our online sourcing platform, HKTDC.com, since April 1st. The pilot month-long Spring Virtual Expo in April drew 1.4 million online buyers from around the world to visit and source, helping suppliers to secure new contacts and orders. To meet buyer demands online in the new sourcing trend, we are launching a Wellness from Within promotion this month, featuring a wide range of well-being products. We will continue to organize more digital shows every quarter this year, including the Summer Virtual Expo next month, to complement its physical fair and create synergy to help SME promote their products during this challenging time. Alongside the Virtual Expo, we offer online business matching as a value-added service. Simply complete a short questionnaire on your sourcing needs, and we will line up relevant supplies and arrange virtual meeting for you. Meanwhile, as the outbreak subsides, the Hong Kong Trade Development Council's Summer Sourcing Week will be held from July 25th to 28th at the Hong Kong Convention and Exhibition Center to help international buyers replenish their stocks. It comprised 9 concurrent fairs, creating a one-stop sourcing platform for a wide range of products. And if you are an overseas buyer, we offer travel sponsorship for you to travel to Hong Kong for the Summer Sourcing Week. Please contact us for more details and eligibility for the sponsorship. SME can also enjoy 50% subsidies of participation fee for joining HKTDC's exhibitions, up to a maximum of 10,000 Hong Kong dollars. The one-off subsidy plan is funded by the Hong Kong government, covering major HKTDC exhibitions from July 2020 to April 2021. Non-exhibitors can also be funded and participate in one of the 5 Showcase Plus online package that we offer for HKTDC exhibitions. And here's a glimpse of the overview for the 5 options with a promotional fee of $1,800 US each, which include either an island, thematic or cubic showcase, garment rack or mannequins, plus the online promotions. That concludes my presentations. Please contact us to learn more. Thank you.
Thank you, Lawrence. So I just want to check that is Ivanhoe, you want to add anything regarding the market update in Hong Kong and Mainland China?
Actually, I would like to say a few words about what Lawrence has already said, that the very good services that Hong Kong TDC has provided. But there are also a couple of things that might be relevant to our business audience here, who has been doing business with Hong Kong, etc. For example, the Hong Kong government has announced a series of measures to support the individuals and business. And one thing that might be relevant to the US businesses, we have what we call the COVID-19 Online Dispute Resolution Scheme, which will be launched in June this year. The purpose of this is that we know that the COVID-19 has create a lot of business uncertainties. And there might be some disputes that due to this COVID-19 between business owners in US as well as those in Hong Kong. So we have this online disputes resolution where just either one of the parties, either the claimant or the respondent, need to be a Hong Kong resident or a company. And then each party will just need to pay Hong Kong dollar 200 in registration fees. And they will be able to settle through this online distribution resolution scheme for disputes below 500,000 Hong Kong dollars. So this might be relevant to some of our business audience. Another thing is that the Hong Kong Science and Technology Park has launched a Global Matching 2020, which is an inaugural one-on-one matchmaking event for global tech ventures to pitch their innovative ideas to corporates from 6 verticals and investors with market-proven solutions and valuable portfolios. So that these companies, if they participate, they can do it both online and offline. And then it offers the fastest track for tech ventures to seek funding, as well as promote their business and build connections. And the deadline for registration will be May 31st. Thank you, Kory.
Yeah, actually, this is really good to know that is Hong Kong and also Hong Kong government and also Hong Kong support keep the business going and a lot of policy and also program is in place. So first of all, I received a couple questions and I want to ask this question probably is for Ivanhoe and Lawrence, if you would like to add on some of the comment. So the first question I have is, lesson learned from Hong Kong's successful containment of COVID-19, how Hong Kong government handled that. What applied to the country like the US, which have different circumstances?
Thanks, Kory, for the question. I'll just try to give it a go. As I mentioned at the beginning, it is somehow very difficult to compare various jurisdictions. In particular, when we look at it nowadays, we see that Hong Kong and US actually are in very different stages. In Hong Kong, we have started to do travel or import restrictions starting in late January, when we already restricted the number of people coming through, the channels of people coming from Mainland China into Hong Kong. And then starting in March, we actually only allow residents coming into Hong Kong, in particular, essentially, those non-residents who are coming from overseas, they now cannot enter by plane. So this is one thing that we have done in order to do this kind of cross-boundary restrictions and also prevention of imported cases. And then also we have tried to, as I mentioned, severing the infection links by extensive contact tracing. And I think this is certainly one thing that the US can do better. Because in addition to what I just mentioned about, we know about who these people have been in contact with so that we can do quarantine. It also helps us to review the kind of scenarios that will be dangerous. For example, we have more than 100 confirmed cases, which are from a kind of bar setting. Those people who went to a bar, they interact with each other, and then there's some extensive, kind of infection. And we identify every one of them, as far as we know. And then there are also situations where we have some banquets, etc., where there are some slightly less extensive, but still a kind of a spread. So these also help the government in deciding what kind of activities we might need to look into and impose certain kind of restriction for the general public good. With here in the US, we have closed starting actually from the Chinese New Year holidays in next January. But of course, given the situation in Hong Kong right now, we are starting to resume in phases, starting this month actually. And there are of course other things that we can, learn from each other. For example, in Hong Kong, one of the things that is very special in Hong Kong is that we have gone through 2003, we have the SARS epidemic, which was hit Hong Kong very hardly. So it is already in the population's mind when another epidemic comes around, we know what we need to do. And this is a kind of a public education that we have been doing for a long period of time. Starting when we know there's a kind of a new disease coming around, people voluntarily already don a mask, face mask when they go into public area. This substantially helped us to limit the number of cases. But of course, on the other hand, this also means there's a strong demand for this kind of face mask. And that's why the government has been introducing some kind of local mask production program in order to help the local production. I understand that, of course, the US is a major production manufacturer of these masks as well, and there have been more and more business which has gone into this kind of business to help ramp up the supply. But I think these are the kind of things that perhaps we can share experience. Thank you.
Thank you. So Lawrence, I have one question for you. So one of the audience want to know that what the safety measure, including social distancing and masks and etc., will be required at the summer sourcing fair and other large event moving forward?
Yeah, we have prepared our fairs with masks and also social hygiene for the attendees, and we are going to put them in place and get it ready so the attendees will be, and the exhibitors will be in a safe hygiene environment when the fair is ready to go in July, late July, and hopefully the business activity will resume by then.
Thank you, Lawrence. So I have other question, probably is for Ivanhoe. How do you explain such as a low, only for that rate and that case in Hong Kong?
Thank you, Kory, and thank you for the question. I think first of all, one thing it has to be done with is because of the low number of confirmed cases in Hong Kong. In a city of population of 7.5 million, we have about 1,000 cases, which is relatively low. And the second thing is that because, as I mentioned, every person who has been tested positive actually are admitted into the hospital. So irrespective of what kind of symptoms they may have, they have already in very good care in the hospital, in the public hospital in Hong Kong, which for those who know, we have one of the very high quality public healthcare system in Hong Kong. So because we know from what we have now look backwards, some of these cases actually the kind of situation can turn very quickly. And if those people are already treated in the hospital, if the conditions change, they can be very well and immediately taken care of by the very high quality medical professionals in Hong Kong. And indeed, in Hong Kong, we have, in addition to just treating the patients, we are also doing a lot of medical research and testing. Here in the Bay Area, of course, everybody knows about the Gilead testing the remdesivir in the US, in various places around the world in treating coronavirus. And Hong Kong is actually one of the places that has been chosen to test this drug. And I think one of the reasons is that because in Hong Kong, we have a very high quality medical teaching system. We have 2 universities which are top class teaching these medical professionals, and also in our system. If the medical tests, if there's clinical trials, they are done in, in a format in a proper way, the results actually are not only recognized in Hong Kong, but they are also recognized in Western as well as in the Chinese jurisdiction. So this is, of course, it's just to show that Hong Kong can play and can do a very important role in helping international health authority and drug companies also to do this kind of testing. I think, and this is probably some of the reasons that explain the lower number of deaths. Thank you, Kory.
Yeah, and a follow-up, this is a question is, so elaborate of the isolation or quarantine measurement. What else should the traveler be aware of if they would like to travel to Hong Kong? The mute.
Okay.
Yeah.
Okay.
Yeah.
I have one slide. Yeah, I have one slide on this, which maybe I can show. This one. Yeah. We have some enhanced anti-epidemic measures. As I mentioned just now, right now, if you come into Hong Kong by flight, only Hong Kong residents can enter. Non-Hong Kong residents, if you come to Hong Kong, we will look at where you come from. If you come from, for example, places like US, UK, etc., sorry, you can't land. Probably you can't board flight if the airline is aware of this. But if you are a Hong Kong resident, you need to go through a 14-day compulsory quarantine, irrespective of whether you have been tested positive. But of course, before you go into quarantine, actually every inbound traveler needs to go through a test. They need to take your deep saliva sample to test. And for people coming in from the US, the traveler will need to stay at the airport to wait for the results of the test. Because it differs from the different people at the time of day when they arrive in Hong Kong. And this test results sometimes can take a few hours to come to return. So we have actually made arrangements for those arriving in the afternoon or arriving in the evening. We have arranged a holding center near the old Kai Tak Airport. We have a hotel which has been designated as a holding center. If for those travelers who arrive in the afternoon or in the evening, they will be transferred to this holding center to wait for the results of the report. If the report turns out to be positive, then the traveler will be admitted in the hospital. If not, they will need to go through a 14-day compulsory quarantine. I would like to mention also that, as I mentioned, we very closely monitor those who are close contacts of infected persons as well. So imagine you will come as a group or as a family, and one of those incoming traveler has been tested positive. Then you need to be prepared that the family members, being close contacts of the person infected, although they do not need to be admitted to hospital, they will probably need to go into a mandatory quarantine rather than a home quarantine. This is just for the safety of the public in general, as well as those people who might have been infected. And these are the things that people would need to be aware. So you need to prepare for a 14-day period of time where you will be staying at a hotel or at home or even probably in a quarantine center before you can proceed on your actual work or seeing people around. Thank you, Kory.
Thank you. So maybe this question is for Lawrence. Like, given the current measurement to the COVID-19 in Hong Kong, how do you see business operating in this coming 6 to 9 months? Will most of the conference will be held in the virtual setting, or what can you give us some input on that?
Well, for the time being, because of the quarantine measures imposed by the government, that's the reason why we put on the virtual expo. But we do expect that eventually business activities will resume and later part of the third quarters. So we are planning to reopen our fair and together with the virtual expos, and so that SME can source both from virtual platforms and also the physical fairs.
Okay, great, thank you. So Ivanhoe, I have one more question here. What's what the prediction on how we have an increasing trade tension between China and US now, and also the current situation about the COVID-19 between US and China. So what will it be play out in the upcoming times?
Sorry. Yeah, this is a great question, but also a very difficult one. I would say it's a $1 trillion question, probably is same as people trying to guesstimate when the COVID-19 situation will be gone. All I can say is that we have seen this kind of tension building up not only recently, but in the past few years. I've been here in the United States for nearly 4 years now. And in the past 4 years, of course, we have seen the US leadership's change in attitude in relation to international diplomacy, etc. And right now, we are, of course, here in the US, we're in the election year, which probably also complicates the matter. But from the Hong Kong's point of view, being a very internationally oriented economy, also an open economy, any kind of this kind of trade wars or tension would not bode well. In particular, in the period of time right now when everybody needs to focus a lot into handling this pandemic. So we would rather love to see more international collaboration rather than international competition, etc. But I don't think I'm in a position or be able to predict what is going to happen. And would be, of course, would love to hear more from other people to share this opinion. Thank you, Kory.
Thank you. So I have the last question for you also is Ivanhoe. Maybe is the prediction as well. So let's say the vaccine is developed and available. Do you see that Hong Kong will encourage people to take the vaccine?
Although I cannot say on behalf of the medical professionals, which has been taking a lead in this whole handling of pandemic. In fact, in Hong Kong, we have a very good, a panel of very internationally renowned specialists in public health, which is leading all these kind of public policies in terms of handling the pandemic. And I cannot say on their behalf, but I would imagine when a vaccine is widely available in the world and available in Hong Kong, a reliable one, a lot of people in Hong Kong will voluntarily want to do this. And of course, the government will be ready to support as well as to encourage people to do this kind of inoculation in order to make sure that this kind of pandemic will not continue in Hong Kong. And also that would actually protect the world as well, not only in Hong Kong.
Yeah. Okay, great. Thank you. Thank you so much, Ivanhoe and Lawrence, for today's discussion. It's really helped me to understand what is the Hong Kong position, and also understand that what we can learn it from Hong Kong during this COVID-19 pandemic. So now I'm going to pass it back to Yanni.
Let me unmute myself. Thank you, Kory. Thank you, Ivanhoe and Lawrence, for the insightful and informative presentation. I'm sure that for any overseas Hong Kong citizen or people, they have business or personal connections with Hong Kong, we find this presentation very helpful. So at the end of the webinar, I would just like to share a few of updates with the audience here. Okay. So HKANC, we're going to have the upcoming webinars next week and the week after. If you're interested in learning more about the new employment law exposure, then you may want to join the webinar next week. And if you want to learn more about the Bay Area commercial real estate market dynamics, and you may want to save the date for the June 3rd webinar. And of course, all the webinars will be recorded. If you don't have time to participate, it's fine, because you can always go back to our website, www.hkanc.com, to rewatch all the recordings. And lastly, after we close today's webinar, you will be asked to participate for a 2-minute survey. So we really appreciate if you can take time to finish it, because all of the feedback will be very helpful for us to organize the future events. So thank you very much for attending today's webinar, and thank you again for the speakers and also the moderators' input. I will now close the webinar, and please stay safe and have a nice rest of your day. Thank you.